So the codes are going to be entirely different. For an AK, you will have to remember 17,000 series. 17,000, 17,003 and 17,004 is purely for AK. Benign is 17,110 and vascular malformation is, you need to go with 172, 17106, those set of codes. And for malignancies, you can go with 17262 or 17282. Fine? Okay. Now you see, I am going to give you an example where the provider is treating 13 AKs. So you will have to report as 17,000 and 17,000 times 12. For 17 warts, you can report 17,111. For hemangioma, you can report 17,106. And for a BCC of chest of 2 cm, 17262. So this is how you will be getting the examples where you will have to report for all the codes based on the conditions, based on the diagnosis. Usually, the treatment of the recipient area bundles the treatment of the donor area, meaning we are not supposed to code separately the treatment for the donor area because it is a recipient area which we are going to give the attention. So the treatment of the donor site is included into the treatment of the recipient site. So this should be kept in mind, okay? So now here the provider is going to do, he has to prepare the wound, the recipient site, he has to prepare it, right? Because immediately he cannot take a graft from a different part. Say if it is an autograft where they are taking the graft from the patient's back and they are going to place it on the leg. So the provider will have to make the bed ready, prepared actually for a subsequent placement of graft. Otherwise, it will be rejected. Even though it is a patient's own graft, sometimes there are possibilities of rejection, transplant failure. It happens, right? It gets rejected. The body does not accept. So the physician has to debride it and he has to do the routine debridement, routine removal of these devitalized tissues so that this does not get rejected at the recipient site. So here we have a special code called the surgical preparation. This is used when there is an extensive debridement and cleaning being done at the recipient site over and beyond the routine way. In such cases, you can report the surgical prep codes. For example, imagine the physician is going to treat a wound on the patient's trunk for which he is going to place a synthetic graft. Okay. So here, and if there is an extensive debridement that has been done, now the physician can report the code for the application of skin grafting, that code, plus a surgical preparation code. And imagine if the provider is placing the epifix, that is a kind of a synthetic substitute graft. You can also report for the substitute graft as Q4186, which is a HCPCS code for that, and into times 5, maybe 5 units of that graft you are utilizing. So this is how you will have to go. It is all pretty simple. Know the type of graft which is being done, whether it is epidermal, dermal, FTSG, STSG or a skin substitute, and then depending on the anatomic site and on the areas that is being treated, you can use that.